Service Workforce Strengthening
Recording started.
by USAID partner Capacity Plus. As many of you know, this webinar series was suggested by participants who attended the PEPFAR-funded Social Welfare Workforce Strengthening Conference held in Cape Town last November. The conference, like these webinars, was intended to highlight challenges faced by the social service workforce and explore strategies for addressing those challenges at a country and a global level. Over 150 individuals from 18 countries attended the conference last year, and it provided an opportunity for country teams to share experiences and promising practices and develop concrete action plans for strengthening the workforce. Nearly 1 year has passed since we gathered together in Cape Town, and many of you have made impressive progress towards achieving your workforce strengthening goals in the past 12 months. Unlike previous webinars, today's session will not focus on a specific social service workforce strengthening topic, but rather provide a forum for country teams to report on the status of your work plans, including progress achieved, ongoing challenges, and your plans for the future. Today's session will be chaired by Nankali Maksud, Regional Advisor of the UNICEF Eastern and Southern Africa Regional Office, and will feature presentations by 3 country teams, as well as invite reports from other country teams logging onto the webinar. This webinar is intended to serve as a forum for us to inspire one another, to offer advice and support, to work together to identify solutions to common problems, and to celebrate our successes. So to launch our celebration today, we're joined by Robert Clay, Deputy Assistant Administrator for Global Health and Acting Special Advisor for Orphans and Vulnerable Children. And Robert's going to offer us a few words of congratulations before we begin. So I'm going to hand over the floor to Robert.
Thank you, Mari, and welcome all of you. I thank you for this invitation really to join this webinar today. This is the first time I've done this, so it's exciting to see the new technology. On this first anniversary of the Social Welfare Workforce Strengthening Conference that was held in Cape Town last year. I'm well aware of the mandate of the social service workforce is formidable, and I'm also aware that the workforce faces complicated social problems and overwhelming workloads, and that under these conditions burnout is not only common, it is expected. Often the work of social service workers is thankless. So those of you who work in the field of social service, I want to thank you very much. In addition, I want to commend those of you who support this critically important workforce, those of you who are involved in efforts to better plan for and finance the workforce, better train and develop the workforce, as well as those of you who support the workforce through strengthening supervision and professional associations. We know that strengthening the social service workforce is a multi-year effort, and it will take years to realize the type of measurable impact we aspire to. Yet the reports that we have received from you over the past year indicate that we already have much to be proud of. Today, as you review your achievements, the challenges that you face, and your plans for the future, I want to congratulate you for all that you have been able to accomplish so far. And in particular, I want to congratulate the 3 countries featured in today's webinar: Uganda, Nigeria, and Malawi. Countries which are in the process of creating new accredited training programs, expanding workforce cadre, and increasing government funding for the social service workforce and sector. I would also like to acknowledge the contributions of our government counterparts, especially those presenting today from Uganda's Ministry of Gender, Labor, and Social Development, and Nigeria's Federal Ministry of Women's Affairs and Social Development. Your commitment and leadership within these efforts is inspiring. In addition, I want to reassure you that the U.S. government will remain your partner in these efforts. Over the past 6 years, PEPFAR has provided critical support to nearly 4 million children. The second phase of PEPFAR emphasizes the sustainability of initiatives to prevent HIV/AIDS infection and to care for and treat those infected or affected by the disease. As a result, PEPFAR has increased investments in strategies to strengthen systems, both health systems and social welfare systems, and the workforce is supporting them. Workforce strengthening is also a key component of a new global health initiative, which emphasizes outcomes associated with building on and expanding existing country-owned platforms to foster stronger systems and sustainable results. One of the strategies for pursuing this outcome advocates for improving health resources for health by training current and additional health workers, deploying workers, motivating, mentoring, and retaining trained workers. Both PEPFAR and GHI have adopted clear targets for expanding and strengthening the health workforce, including a target of 140,000 new health workers by 2014. Already we know that many of you all are contributing to this target by training social service workers. For example, in South Africa, PEPFAR is supporting efforts to train 596 child care workers and 500 social welfare assistants over the next 3 years. These new workers, like other social service workers, seek to address the social determinants of health, which WHO defines as the conditions in which people are born, grow, live, work, and age, and which can lead to significant social and health inequities and other concerns. By working together, health workers and social service workers can more effectively pursue their mutual goals by ensuring the health and social well-being of most vulnerable children and families. This is truly an exciting partnership and already a fruitful one. I look forward to continuing to follow your progress and to celebrate your successes and the debates and discussions on the webinar. Thanks very much.
Thank you. We're very pleased that you're able to join us today. Now, we want to, just very briefly, I want to go through the agenda to let you know what's going to happen during this webinar session. As you know, this is the third webinar in our series, and we launched the webinar series in July with a session on lessons learned from the global health workforce, followed by a second webinar in September on social service workforce training curricula. Both sessions were well attended, and a summary of the sessions, PowerPoints, and a recording from each of the sessions may be found on obcsupport.net, where we will also post information about this session and future sessions. So for those of you who are unfamiliar with obcsupport.net, please note that the webinar, that the website includes a range of resources and information on how to engage in social service workforce strengthening initiatives, as well as more general information on programming for vulnerable children. So I'm going to move ahead through our webinar and to our agenda to let you know, to just give you a sense for what we're going to be talking about today. So we've already heard opening remarks from Robert Clay, and Ms. Nankali Maksud is going to provide us just a quick overview on what has been going on within various countries that attended the conference last year, how you have addressed workforce issues, some of the challenges that you faced, and then also welcome our presenters today. And our presenters are from 3 countries that you all should know very well. Uganda. We have a colleague from the Ministry of Gender, Labor, and Social Development who's going to talk to us a little bit about what Uganda has been able to achieve over the last 12 months. In Nigeria, we have a colleague from the Federal Ministry of Women Affairs and Social Development who's also going to talk to us about their experience. And then finally, Malawi. We have a colleague from UNICEF who has been working closely with the government in Malawi to address workforce strengthening issues, and we're going to hear a little bit about those. After each of these sessions, there's going to be a question and answer period, and you will have an opportunity to both write questions in the chat window as well as, if time permits, to use your microphone and to raise your questions yourselves. By expressing them to the presenters or to others that can address these questions that you have. And then finally, we're going to reserve a little time at the end of our session to invite reports from those of you who are not presenting, but who have much to report on the things that you've been able to accomplish over the past year. So just a reminder, you are welcome to write questions or comments in the chat window throughout the webinar, and we will do our best to address these questions following the presentation. So as the questions come to you, write them in the chat window. We'll make note of those, and we will ask the presenters to respond to those. And we've already heard opening remarks from Robert Clay, so at this point I think it's time to invite Nankali Maksud to provide a brief introduction and overview of where we are 1 year later.
Thank you very much, Maureen. As noted by Maury, the Social Welfare Workforce Strengthening Conference last year in Cape Town provided an opportunity for country teams to develop realistic, time-bound plans to address workforce challenges as well as outline longer-term global goals such as new research agenda areas, ideas for global workforce benchmarks, advocacy and coordination plans. For many countries, implementation of these plans has taken longer than expected. There's been a number of challenges faced, and I'd like to share a few with you. Ministries of social welfare continue to lack the fiscal space, and their authority is severely limited, and the data available to inform workforce strengthening decisions is incomplete. Many countries have faced tremendous difficulties identifying much-needed allies and champions, engaging key decision makers, and coordinating the many players with busy schedules whose support is essential to achieve a strong and capable workforce. Many social work educators and trainers continue to work with outdated curriculum and training modules. For many of these curriculum, you will note, most are not responsive to African culture and tend to be designed from a pre- or post-colonial period. Efforts to disseminate and promote more relevant training resources have been slow to proceed. Processes for approving and accrediting training have likewise been delayed, and mechanisms for adapting programs to train social service workers for specific critical positions are insufficient. On the whole, social service training institutions remain ill-equipped to meet the demand for social work graduates. Finally, we know that social service supervisors continue to be poorly prepared to help frontline social workers in both the formal and informal sector to deal with daily stress of working with such vulnerable populations. In addition, where professional associations exist, they report that they continue to lack the resources they need to provide the level of advocacy and professional support required by the social service workforce. Having said that, a number of achievements have been made. In terms of planning for the social service workforce, we've heard from many of you about successes in identifying powerful and enthusiastic social service leaders who have formed diverse and dynamic working groups to manage workforce strengthening efforts. In one of the countries featured today, Malawi, the Permanent Secretary of the Ministry of Gender, Children and Community Development has adopted workforce strengthening as its personal mission. The impact of such senior-level African leadership cannot be understated. Other country teams such as Kenya, Haiti, and another country featured in today's webinar, Nigeria, have spent the last year collecting more accurate information about the workforce. A few of these countries are also in the process of establishing more permanent data management systems to ensure the data is available for decision-making and up-to-date in the long term. Colleagues in South Africa are in the process of carrying out an analysis of a range of social service professions, including identified required competencies, training, qualifications, responsibilities, as well as supply and demand for social service workers. Comprehensive organizational reviews have generated new efficiencies and a more robust workforce for more clearly articulating the roles and responsibilities, task shifting, and helping to mobilize new sources of funding. We've seen structural development taking place. For example, in Malawi, the ministry is in the final stage of establishing a separate department of gender affairs, child development, community development, and social welfare. We've seen leveraging taking place in Mozambique. The country is going to include a component to fill social work vacancies in the Global Fund proposal for round 11. We've seen innovation. In Zimbabwe, the Council of Social Work is working closely with the Department of Social Services to operationalize bylaws allowing private social workers to carry out specific statutory functions previously carried out by public social workers. This, in effect, would enhance the capacity of the public social welfare workforce without establishing new public social service posts. We've seen evidence-informed advocacy, and this will be shared later during this webinar. The Ministry of Gender, Labor and Social Development in Uganda developed an issues paper highlighting human resources and funding gaps to constrain provision of child care and protection services and advocating for increased funding for social development sector and increased staffing. This issues paper, which has been shared with you, will be discussed further during the webinar today. In the area of developing the social service workforce, there have also been a number of achievements that have been shared by you. In Mozambique, a new certificate-level training program for community workers has been translated into Portuguese, endorsed by the Ministry of Social Action, and is in the process of being submitted to the National Accreditation Board. This certificate course, which was also shared in a previous webinar by the Regional Psychosocial Support Initiative, it has gone to a second stage in developing a new diploma program for community-based work with children and youth. Malawi is in the process of finalizing a social work diploma and degree program. South Africa, likewise, is launching a new childcare worker degree program. In supporting the social service workforce, also a number of achievements have been shared. The Tanzania Association of Social Workers, some of whom members are with us here today, and other key stakeholders have formed a task force with the intention of developing a social work council to regulate social service professions. In Uganda, the National Association of Social Work has likewise been revived and supported to register and mobilize members, as well as to assess and monitor the workforce size, categories of occupations, and training. The global level has not been left behind. The Social Service Workforce Strengthening Agenda was represented during the 2001 Global Forum on Human Resources for Health. Many of you have had Maury talk about the Library of Resources to support social service workforce strengthening, posted on ovcsupport.net. The Social Service Workforce Strengthening webinar series such as this is already providing a bi-monthly forum for focusing on common concerns, networking, and disseminating new models, tools, and ideas. That's all from me. We're very grateful for the presenters who have agreed to come onto the webinar today. Let me not delay and go ahead to introduce Mr. James Kaboggoza, the Assistant Commissioner for Children, Ministry of Gender, Labour and Social Development. Welcome.
Thank you very much. Thank you very much. I'm also honored to be presenting to this webinar, and I'm going to present on the social welfare workforce strengthening Uganda progress since November 2010. I'm James Kaboggoza Sembatya, and I'm Assistant Commissioner for Children in the Ministry of Gender, Labour and Social Development in the Department of Youth and Children. After 1 year, we can be able to report a number of things, but we need to start with what we were 1 year before. And the status of the social welfare workforce in 2010, we have 59% vacancy rates among child care and protection frontline workers, that is community development officers and probation officers. And out of 1,035 sub-counties which were analyzed, 144 sub-counties had no single community development officer position filled, and 44% of districts had no substantive probation and social welfare officer, and this is the position mandated to promote implementation of the Children Act. 72% of community-based services staff did not have adequate skills in social work. Resource allocation for the social development sector was only 0.5% of the overall government of Uganda annual budget. And local revenue allocations by local government averaged at 1.3% in 2008-2009 financial year, and at 1.4% in 2009-2010, with minimal allocations to the social welfare sector. None of the conditional grants transfers to local government are for child care and protection. What are the efforts that have been there to address challenges over the past year? Achievements, issues paper. We have conducted a survey to analyze the staffing and funding of the social welfare sector in local governments. We have documented the findings in an issues paper that provides 5 recommendations to increase funding and staffing of the social welfare sector. We have conducted an advocacy meeting targeting sectoral committees of Parliament, social services, HIV/AIDS, Gender, Labor and Social Development and Equal Opportunities Commission. The parliamentarians adopted the recommendations. Child Protection Curriculum Development, the Ministry of Gender, Labor and Social Development, UNICEF and Psychosocial Organization TPO, which is a national NGO, initiated a partnership with the two universities and the Sembatya Institute for Social Development to develop child protection curriculum for universities and colleges. The technical working group comprising academia and practitioners was formed and worked over a period of 1 year to develop graduate, undergraduate, diploma and certificate modules. We are currently working with the National Council for Higher Education for accreditation of the courses. Adoption of child protection curriculum. Makerere University has already adopted and is teaching the master's and undergraduate modules. Kyambogo University is in its final stages of adopting the undergraduate course. The Sembatya Institute of Social Development is also finalizing adoption of undergraduate and diploma modules. The certificate course targets practitioners who are already in service and other pre-service candidates who will mainly work at community level. Plans are also underway to run the first intake for the certificate course. And a 3-day workshop was conducted for the team of course facilitators from different professional backgrounds to adopt the common pedagogical approaches in rolling out the course. This course was actually completed over the weekend, last week. National Association of Social Workers. We have also supported the National Association of Social Workers, which has been revived. Initial funding has been obtained to support registration and mobilization of members. And the association is planning to ascertain the size of the social workforce and to categorize social workers based on their occupations and possibly professional training. What are the lessons learned? In order to successfully integrate child protection in university curricula, it is important to work with the university faculty, who in turn act to advocate within their departments for integration of the developed modules. And this has been the case in Makerere University. It was very easy to penetrate there because we were working with the lecturers there. Utilization of university lecturers and practitioners in rolling out of the courses is crucial as part of mentoring university lecturers into teaching the modules in a manner that is practice-oriented. Ongoing new obstacles or challenges and plans to address them. There is a contradiction of getting the limited staffs from the job to attend in-service training with 3 months course. Plans are underway to further refine the course and reduce the training period. Other plans are to have a 2-week face-to-face session and provide learning exercise to trainees who will later conduct field placements, and probably trainers will find them there for mentoring. Challenges. The budget ceiling for each government sector, as reflected in the medium-term expenditure framework, may affect increasing funding of the sector. This MTF, the budget ceilings tend to be a bit rigid, and it might be a problem convincing people to actually changing them and increasing them. The issues paper is yet to be presented to Cabinet for action. The Minister of Gender is planning to transform it into a Cabinet memo for onward submission to Cabinet. And we feel that once it is accepted by Cabinet, then it will be policy and it will be accepted by every district, and they implement it as per the recommendations. Dissemination of the paper to local government authorities is ongoing. It cannot wait. We are doing that because districts in their own right, they are independent, they can implement the recommendations that are in this paper. Future plans for workforce strengthening. Where do we hope to be in 5 years? Rolling out the child protection modules and integrating them into curricula of at least 5 universities which will have benefited over 1,000 pre-service graduates. And I would think we can achieve this because already some have already started training. We have 80% of in-service social welfare workers and other social services professionals engaged in child protection practice to be trained using child protection modules, and this will start just in the near future. The National Social Workers Association is to be supported to strengthen its capacity to regulate professional practice and provide training opportunities to its members. There is an annual general meeting for the Social Workers Association which is scheduled for this actual weekend. So we feel we are going the right direction. Future plans. Continued advocacy for increased staffing of the social welfare sector up to 60% of established positions. At the moment we are operating at about 45%, but we have just had permission from the Public Service Commission that actually we ought to increase it to 60%. That is the acceptable number. It is acceptable because that is the money available for the staffing. So we now have to fill it up to 60%. And increasing advocacy to have funding for social welfare sector increased. We want to increase it from 0.5% to 1% of the national budget at the national level. And at district level, we think we should push it. At local government level, we should push it from 1.4 to 3%. And we feel that this can be done since already we are moving in the right direction, because earlier before we were receiving 0.05. Now we are in 0.5, and probably we can advocate and push it further. Conclusion. We believe that by combining efforts and resources, learning from other countries, we can improve the status of the social welfare sector in Uganda in terms of human resources, capacities, and funding within the next 5 years. We, as a ministry, we acknowledge the participation of all these people you see on the slides, Minister of Gender, Labour and Social Development, USAID, UNICEF, International HIV/AIDS Alliance, Transcultural Psychosocial Support Organization, Oak Foundation, and many others that I cannot mention here. I'd like to thank you very much, and of course for any contacts, the address is there, email address is there, and you can contact us anytime for any information. I'd like to thank you very much for listening to me.
Oh, we hear lots of clapping going on here. That's terrific. This is Jim McCaffrey from Capacity Plus, and I will be facilitating us through the question period. But I really wanted to thank our colleagues from the university, from the Ministry of Gender, Labor, and Social Development, and for that really great presentation. And also to acknowledge that it started with a workforce and fiscal survey, which then provided the kind of data necessary to take it forward and look at interventions like trying to change the curriculum and modernize it, and look at getting universities to adapt it, and look at ways to expand its use and to do advocacy for staffing and so on. So it was a very good presentation, and what we would like to do is then to open it up for questions, which we could then put to our colleagues from Uganda. And probably the easiest way to do this at this point is for you to write your questions in the chat room, and then we will pick out a few. We may get to answer all of them or not, and ones that aren't, then we will generally, we have some follow-up on ovcsupport.net. But let's start with a question, while you're writing, let's start with a question that's already came in. Somebody wrote that he described 72% of the workforce as having no social development skills. What kind of background was commonly did these people have, and what was the incentive to work for them? Were there any attrition issues? So I would ask James and his colleagues perhaps to address that question.
Yeah, thank you very much for that question. 72% refers to the kind of workers we are talking about, actually probation officers and community development officers. Community development probation officers are responsible for planning for child care and protection at local government level, that is district level. But under that, we have another level which is called sub-county level. And at sub-county level, we have what we call community development officers. And these ones are also responsible for child protection, for care and child protection at that level. But although they might have had some training, general training, they are not yet trained in the things like child protection, in the rights and all these other things. And the recruitment is actually not, the recruitment that happens at district level does not only target social workers. It also brings in people from other disciplines. And these people from other disciplines need to be inducted and also trained into the work that we do with children, and also we do with preserving the family, strengthening the family, and so on. So 72% of these are actually in position, but they are not trained in these. They are not given this technical competence and also the skills. Thank you.
Okay, James, thanks very much for that question. We have another question here, and that was, what specific activities and investment does the 0.5% of the government budget cover? You mentioned that a couple of times, and you also mentioned you're hoping to advocate for a higher percentage. What does the present 0.5% cover?
Yeah, thank you very much for that question. The 0.5 budget is a budget that covers what the ministry. As I was explaining, despite this, the activities that are covered at district level, probation officers are officers of the court. They act as advocates for children that have been charged with offenses. But at the same time, they also plan for the prevention and protection of children against abuse and neglect within the district. They also support as key stakeholders, as civil society organizations within the districts to be able to carry out their work. They also carry out quality assurance exercises with the key stakeholders, because in the district and the sub-county level, they are the most trained and the people that have the mandate to check the quality of services being provided for people in those areas. And of course, generally the Department of Youth and Children is a department that is responsible for planning and programming for child protection. They come out with policies, they implement the policies, and they get a strategic plan, they implement them, and they oversee quality assurance within the districts that we have in Uganda. Previously we had 80 districts, but right now they have increased to 112, and that is adding to the challenges that we are having and the work that we have to do in strengthening our workforce.
James, for that answer, and we do have a question about the Association of Social Workers, and could you provide a bit more information about how the National Association would regulate social workers, and what is the role vis-a-vis government regarding regulating the social workforce, social service workforce? So that's the question.
As I reported in the presentation, the association has been weak for some time, and we are just reviving it because we do realize that part of the problem we are having with our social welfare workforce is that it's not regulated, and sometimes they are not very ethical in what they are doing. And we think if we revive the Social Workers Association, and this is very important to us government, and because that's why we have initiated it. We think if we strengthen the association and is able to do what it's supposed to do, it can help us in regulating the practice of the social workers, but can also help us in training our social workers and updating them on the new methodologies of working with children. But we also think that way we can be able to advocate within Parliament and of course with Public Service Commission, and ensure that actually Public Service Commission, when it comes to recruitment, if you want to recruit social workers for the positions that we are talking about, it's beginning, but we think we are going into the right direction because we've managed to get funding for them for about the next 4 years. And after the 4 years, we'll be able to judge and evaluate and see how much we have achieved. But this is better than what we had before. For about 10 years, the association has been dormant.
James, a quick follow-up question to that. You mentioned, so basically you're setting out to on a program to strengthen the association, and you mentioned you got funding for 4 years. Where was that funding coming from?
Thank you very much. That's a very good question because it's not very easy to get funding for associations like this. But we are working with Oak Foundation. The main funding is coming from them. But also we are getting funding from UNICEF, and government is also putting in some funding. So we hope that the partnership will be able to drive this process. Thank you. Thank you.
Okay, we want to thank you for both the presentation and for responding to the questions. And there are other ones that we won't have a chance to get to. And if you're so moved, you can also answer some of them directly using the chat room, or we'll figure out a way to do that afterwards through ovcsupport.net. But we would like to go ahead and move on and thank you very much again, and move on to our next tour. We're moving from East Africa to West Africa, a little bit of a tour of Nigeria and some of their issues. And so, what we would like to do is turn this over to Mr. Kwassau, who is the Director of Social Welfare in the Federal Ministry of Women Affairs and Social Development. So why don't you go ahead, and we'll see how your mic works.
By November 2010 in Nigeria was as follows. We discovered that there's lack of social work, so that it can be passed to law to ensure that professional social workers are created by law in the country, where their practice can be protected by law and the clients they serve. The government scheme of service for social welfare development officers is not meeting the professional standards and not covering all officers engaged in the social work in the country. The social work curriculum is yet to incorporate the provisions of the Child Rights Act and the state child rights laws. We lack of standardization of the informal workforce training programs run by non-governmental agencies and non-governmental organizations. They will have a problem of limited support for continuous capacity building of social development workforce in Nigeria. For instance, we have these challenges of in-service training and career development programs. We have limited social work training institutions in the country. For instance, out of the 50 universities in Nigeria, only 9 are offering various programs from first degrees and master's degrees in social development training. And out of about 30 polytechnics and social development training institutions in the country, only 10 of such are offering social work training programs. However, there are efforts taken to address the challenges up to date. We have a feature of consensus building situations that we call all the various stakeholders in the country to see how the terminology of social welfare workforce and social development workforce can be properly addressed, so that we are really on course. And so we've agreed in the country, Nigeria, that we shall adopt the terminology social development workforce because it's more embracing. So we are engaging wider stakeholders in this respect. For instance, we recently held a stakeholders meeting in Nigeria on the strength of social development workforce, where about 60% of participants were engaged in the discourse, and this spans through the following establishments that send in the stakeholders to represent their various interests and make input into the efforts of strengthening the workforce in the country. And this organization included the following: the Nigerian Universities Commission, NUC, that's in charge of accrediting courses and programs of universities at all levels. We have the Nigerian Association of Social Workers, NASO, that's the national chapter, including the Federal Capital Territory chapter that we drew to represent states. We have the National Board for Technical Education that's in charge of accrediting diploma programs at the national level and the higher national diploma programs. We have also the National Association of Social Work Educators in Nigeria. This is an association of persons that teach social work training programs in the universities and the polytechnics at both diploma, national diploma level, and national diploma, master's degree, and the PhD program. We have also drawn the Office of the Head of the Civil Service of the Federation, where the career management of officers and scheme of service is managed, so that officers can join and have a career progression with respect to the professional social work practice. We have also engaged the Office of the Senior Special Assistant to the President on the MDGs, because this particular office funds, there's a special fund that funds various activities of government, including the work on vulnerable groups, including children, persons with disabilities, and so forth. So our efforts to address the various challenges and the areas of priorities identified by the stakeholders in Nigeria include the following. There's an assessment of the social development workforce to identify the workforce and its issues in Nigeria. There's advocacy for social development workforce strengthening at all levels, beginning from the federal level, the state level, and the local government at the grassroots level. There's also the issue of professionalization of social work and regulatory mechanism strengthening. That is, we're seeking strongly at embarking on various initiatives to ensure the establishment of the legal framework and licensing of the social workers, so that their practice can have quality. I'm also working, to review the scheme of service for all social work practitioners in government services. We also on the effort to strengthen the professional association of social workers and the social work educators in the country. We are also working to update the training education program to incorporate the Child Rights Act and state child rights laws, which are really novel and new to our setting for now. There's also effort to standardize the informal workforce training programs. And then we have effort to sustain the budgetary provision for social development workforce strengthening in the country. However, we have the following ongoing challenges. There's this problem of lack of understanding of the issue of social development workforce by policymakers, because of this see little relevance or importance of the workforce to the development agenda of the country. Well, significant human resource gap at the grassroots level where it is needed most. Limited financial resources allocated to the social development workforce strengthening is a challenge. We have limited research data information available on the workforce, and therefore there's insufficient evidence to guide interventions to undertake effective policy making and planning. We have this problem of lack of clear guidelines on areas of responsibility among the social development actors. For instance, there is duplication of efforts, and there's blood accountability, and the wastage of limited resources. The way forward, plans for the workforce strengthening in the country. However, we're not leaving everything undone. We're making efforts to address the issue of strengthening the workforce in the country. We are doing the following. Within the next 5 years, we intend to construct a national coordinating framework down to the AGA, that's the grassroots level, emphasizing the role of informal workforce and its complementarity to the formal sector workforce. We intend to increase the trained social development workforce in both formal and informal sector by 20% in the next 5 years. The actions planned include the following. Social development workforce gap analysis is being undertaken. The child protection system mapping is also ongoing. We will continuously engage wider stakeholders in advocacy efforts for social development workforce strengthening in the country. And we also intend to promote the stakeholders coordinating and partnership creation at all levels. I believe that dialogues will create more opportunities to discuss and resolve differences and disjoints. Thank you very much for listening to Nigeria.
Hi, Jean.
Anyway, thank you very much for the presentation. And continue to write questions.
Thank you very much. Thank you very much.
You might want to turn your mic on. We will go ahead and handle those questions. I have one just to get us started because it's a question that lots of people are interested in. You put up there that some of the challenges involved a lack of understanding about the importance of the social development workforce on the part of policymakers, and also limited money. And I think those two are related a bit. And I was wondering, from your perspective, I know you've done some thinking about that, but what do you think would make a difference in trying to address that issue or that challenge?
Thank you very much. Most of the years. My question? Okay, thank you. The issue of lack of understanding among policymakers in respect to the social development sector itself and strengthening the workforce has been we're more used to the social welfare services in the country is not really well developed, to the extent that once we make projects and budgets to be able to get resources, particular financial resources, to fund this sector, we have problems of certain persons in government, the National Assembly, the policy makers at the ministerial level and the local government level at the state level, don't sometimes seem to have the good understanding of the value of why social workers should work with, say, orphans and vulnerable children, or the needy in society for that matter, because there's this claim that everybody can do the job. And therefore some government persons don't seem to have the need, or don't see much of the need, to raise our budgetary provisions and allocations to enable us, train social workers and in such a number that we need. However, we make a lot of efforts to explain ourselves, to really position the value of the service that social workers render to the vulnerable groups in the society. However, we are receiving responses because the Honorable Minister of the Ministry leads our advocacy teams, and with the effort of various development partners and donor agencies, UN systems, and other partners are able to reach out to government and explain to them the need to raise the budget. We're receiving a positive response in this respect, however. Thank you.
Thanks much. And it's possible that the other one, that when you do have more research and data available, that might be helpful in those discussions too. Another question that was written in, it was about schemes of service, and that was how you would go about revising the schemes of service.
The social development workforce, we in the ministry, in the government of Nigeria, so far, there are social workers are designated as social development officers. And that's the joint service, the scheme of service that specifies the requirements for joining service, first degree, second degree, particularly in social sciences, or psychology, or counseling, or social work itself. So those particular areas are quite captured in the scheme of service of the federal government of Nigeria. I flow down to the state and local government levels. However, there are social workers that work in other areas. For instance, We have medical social workers. We have social workers that work with the military. We have social workers that work with children. We have social workers that work with in the people's homes and centers for care for older persons. That in that particular sector, they are not within any scheme of service, which means they are not recognized. So they will have challenges of growing in the career. So they may not attain certain levels of career, which means they may not have opportunity for training to benefit from more competencies and be able to perform at a higher level of responsibilities. So that's why this particular stakeholders meeting, and we have a National Steering Committee, is working towards ensuring that we identify the social workers wherever they are and wherever they work, in the situation that we can harmonize the scheme of service and ensure that everybody and wherever he works and is positioned is known, is discovered, so that his services are streamed together, so that every worker in this sector, both formal and informal, can have an opportunity for growth, for career growth and development. Because the scheme of service will recognize such a person and place him or her appropriately as he moves on the job. Thank you very much.
Thank you for that. So basically you're looking at some social workers have schemes of service, but there are an array of others that don't have them, and so partly what you're doing is moving towards getting schemes of service. I have another question here. Yeah. Okay. Another question, which is a bit of a change of subject, but can you talk a little more about mapping the workforce and how you're going to do that? Maybe some of the tools you're developing and some of the groups involved. I think you mentioned a bit about that, but could you expand on that? And some of the groups involved. I think you mentioned a bit about that, but could you expand on that?
Okay, please, can you repeat that question?
Sure. The question was written in, it says, can you talk more about mapping the workforce and how you intend to do that, and whether you have any tools you're developing or what groups are involved. So it was about mapping the workforce, how you plan to do it, whether you have any tools.
Okay. All right, thank you very much. We intend to embark on surveys and census of social workers wherever they are, because we're able to work to identify where social workers operate in Nigeria. For instance, they operate in ministries responsible for social development in Nigeria, or some operate in the National Poverty Eradication Agencies in Nigeria, some operate from the National Emergency Management Agency in Nigeria, others operate in hospitals as social workers. Others are also in the informal sector, that's in the community areas where they work at the grassroots, at the village level. So we intend to undertake a census, a national census, and a survey to identify this particular workforce, their competencies, their qualifications, if at all they have any. Where they don't have, we intend to mount programs of intervention to ensure that we run certificate courses or diploma courses for such officers that require training. I'll be working with the Office of the Head of the Civil Service of the Federation to ensure that such qualifications are recognized and captured in the scheme of service for engaging and ensuring the growth and development of social development officers in the country. Basically, we are going to do that through a national survey. And we also have already developed, working with UNICEF and the USAID, we developing tools and instruments that will go to the field and be able to gather such data and to be able to produce a report that will enable us have sufficient and reliable data and statistical information to be able to plan programs of intervention. Thank you very much.
Okay, just a quick follow-up question there. You mentioned in your presentation about the role of the informal workforce. Now, is the mapping more about the formal workforce, or will you have some way of including the informal workforce in that?
Yes, thank you very much. You know, we at the local government level, there has been a survey that we undertook, and we have 774 local government areas or councils in Nigeria. We've been able to go on the census of such a local government where they took a survey of such the characters of the workshop at the grassroots level, because these are the people that work with the people in the community. We were able to discover that only 132 local government councils, which constitutes 70%, doesn't have a focal officer for vulnerable children, and 3 states have no presence of any level focal person at the, focusing on children. We also discovered that the reporting system at this level of, social workers report to education, some to health, some to women affairs, some to primary health care, for instance, development agency, instead of reporting appropriately to the social services department of the local government councils. So we are going to collaborate very closely with the local government departments, relevant department at the local government level, where we can reach out to the community and spot and discover where social workers operate, so we're able to provide some capacity building programs for them to enable them carry on their jobs. We also have the child protection mapping. We are proposing we fit into the mapping processes also, because in Nigeria, like we said earlier, the social development workforce does jobs in addition to the child protection job. They do other jobs also. So we intend to ensure that the child protection mapping is a priority in this particular project, so that this particular vulnerable group for which this program targets will not really be left out in the efforts to address the issues of vulnerable groups and the needs in Nigeria. So we intend to also do the mapping in both formal and the informal sector in details.
Both sectors, and with, especially with the informal sector, there is an emphasis on trying to get to the LGA and the community level, where that kind of effort would be more, where you would probably find more information out at that point. We have one last question and then we'll move on, but it was a question just written in. It said, you rightly suggest that this process should not be donor-driven. What should be the appropriate role of donors in supporting social, he put social welfare, I'll say social development, because that's the term of choice in Nigeria, the social development workforce strengthening?
Like I've earlier said, you see, we're pushing for increased and improved budgetary provision allocations to enable us carry on, even if the donors are not able to come to the support of government to do so. So we are intensifying efforts in advocacy and proposals. But for technical support, we would to some extent rely on the UNICEF and USAID to do that. Meanwhile, we have an understanding that government would do the would be the major contributor to driving this process, while we rely on the UNICEF and the USAID for technical support most of the time. So we've understood this. Our Honourable Minister and our management at the ministry have been, spoken with or to by the UNICEF and USAID team, and the key officers in the ministry have understood the role that governments have to play, because government at all levels of operation in the country. So we are going to be able to sustain our efforts at this and even strengthen our position, because we have many other agencies, both NGOs and the professional associations of social workers in Nigeria and social work educators who have their own budgets in the university and polytechnics to train social workers. So even if we are not getting really financial support by donor agencies or development partners, we're able to carry on because there are other avenues of resources to be able to build the capacity of social workers in the country. Thank you very much.
Thank you very much. Thank you for the presentation and for the answers. And for this last one, I thought that the kind of clarity around that the government would make the major contribution and that you would be expecting some help from donors like UNICEF and USAID in terms of technical support and technical assistance. So that's great. I think we're going to move on to the third presentation. Thanks much to Nigeria. And the third presentation will give us a chance to move a bit south on the continent and going to Malawi. So Malawi, Bruce Grant is going to make the presentation. And his government counterparts and colleagues are traveling out of the capital at this point, so he volunteered to do this. Bruce, you want to take it?
Thank you, Jim. Good afternoon, everybody, and greetings from Lilongwe, Malawi. It's Bruce Grant here, and I'm sitting in the UNICEF office in Lilongwe. It's raining, and it's quite hot and steamy. The rainy season has just begun, and the city's looking quite green. Apologies from the Malawi team, as Jim said, they're all travelling, so they couldn't be here today, and they asked me to do the presentation. I suppose the first question for all of us in Malawi is, well, why do we need social workers? Why do we need child protection workers? What will they do? Looking at it from a child protection lens, we can see that in Malawi a large number of children are vulnerable. The slide in front of you, if you start working clockwise, basically we know that 1 in 2 children grow up in violent homes. We know that 2 in 3 girls experience sexual abuse by the age of 16. We know 1 in 3 boys experience sexual abuse by the age of 16. We know 1 in 3 girls marry before the age of 19. Looking at the new data that come out of the Malawi Demographic and Health Survey, it's an interesting, when you look at the percentage of girls who marry before the age of 19 and then look at the situation with boys. According to the 210 survey, the percentage of boys who marry before the age of 19 is less than 2%. We know that 1 in 4 children between the ages of 5 and 14 work in very hard forms of child labour. We know if we visit the prisons that there's still children being locked up for poverty, and they're being locked up with adults. 9 in 10 children do not have their births registered. That's particularly important in areas where we have trafficking, girls at risk of early marriage, children in conflict with law. There's a whole range of vulnerable groups where a birth certificate can really add value and protection. When we look towards 2015, there'll be 140,000 children living with HIV. There's 1 in 8 children in Malawi who lost one or both parents, half of whom have lost their parents because of HIV. We know that there are 6,000 children living in institutional care, 12,000 children in child-headed households, and 1 in 2 women experience domestic violence. So in Malawi, there's a lot of work to be done by the broader social welfare, child protection, social protection sector. What I want to do now is take you on a bit of a journey through this map in front of you. And this is the sort of strategic actions roadmap for social welfare workforce in Malawi. When we look back a year ago to the conference in Cape Town, not a lot's changed on the ground in Malawi. Yeah? In the field, we've got 123 social workers spread across 28 districts, and they're the social workers on government payroll. There's a 40% vacancy rate, and on average these workers get a 1 year of training. They're being supplemented by 800 child protection workers, 300 of which are on government payroll, 500 are on a stipend funded through Global Fund, and the government's committed to bringing them on board in 2012. The first big thing that's happened this year has been the establishment of the Department of Social Welfare within the lead ministry. The lead ministry is the Ministry for Gender, Children and Community Development. And this year they divided one department, which was a very large department focusing on child development. They decided to break it into two, one focusing on child development and the other one focusing on social welfare. As Nankali said in her introduction to the presentation, the Principal Secretary from the Ministry attended the conference in Cape Town. So having him there was such an important part of getting real strategic buy-in from the government. One of the challenges the PS has had is that under his previous minister, the minister wasn't overly keen on this issue. He's now had to, he's now got a new minister and he's managed to get her on board, so we think things are going to move now much quicker. In Malawi, we've developed a social welfare curriculum for degree and diploma courses. That's a 3-year degree course and a 4-year diploma course. That's been finalised this year. So now we've got the teaching materials in place, which is critical. The next priority is the training college. So there's an existing training college in Malawi that's part of the Ministry for Gender, Children and Community Development that trains social workers, but it's a 1-year certificate course. So the broader goal is about bringing that college up to standard so it can teach the degree and diploma courses. And that's in progress now. And the main aim is to have the first intake of social welfare students in September 2012. So in a sense that covers a broader, more formal part of building the capacity of the sector. We have a department to drive it forward. There's a training college that has as the mandate. There's very good materials just being developed in terms of the curriculum. And there's a plan to get these students in there in 2012. The idea is the students will come from two broad populations. Half of the students will be those existing 123 social workers, to build their skills, and the other half will be from anybody in the community who wants to take up this type of study. What we have planned for next year is to look at the broader social welfare sector beyond government. Excuse me. So we're talking about the workers who sit in NGOs, civil society organisations, people in the field who are doing child protection, broader community social welfare work, how we build their capacities and skills with on-the-job training. So one of the priorities for next year is to work out how to do that, to actually do human resource and training plans. So if anybody's done that or is familiar with that, would really appreciate knowing more. From a UNICEF perspective, the United Nations in Malawi government have just signed off on a new 5-year country program. And child protection systems building is part of that program, and one of the priorities under that is the strengthening of the social welfare workforce. So the idea there is by moving towards the creation of a formal child protection system, the workforce for that system will be social welfare workers who will work across that system, plus the broader social welfare, social protection sectors. So that gives us a sort of a formal commitment in terms of moving forward. In terms of where we want to be in 5 years' time, that's a very good question, and we haven't got the answer to that. But we do know that in 5 years' time, based on the work that's been that's in train, we should have quality and sustainable social welfare practice that should be evident, and we should be on the road to scale. On the road to scale, by that we mean we should have a much better sense in a few years' time about, well, we understand what the need is, we understand what the size of the problem is in some areas, but we still don't have any sense about how you match that workforce up with that need and get some sort of result. But hopefully come 5 years' time we'll be much clearer about, how we get to scale and what scale will look like. In terms of challenges, there's three broad challenges, and interestingly, none are directly related to this project, but they're all very much impacting on that project. The first challenge has been a change in leadership in the lead ministry. So in the year since Cape Town, we're now in third minister for this ministry, and as we said before, the second minister wasn't very keen on this approach. The new minister on board, and she's very keen, so we're hoping to see much stronger movement at that level. Secondly, many might have heard about the aid environment in Malawi. It's very, very challenged. There's a shortage of forex, there's a shortage of fuel. The government and donors are involved in a range of very robust debates. And when it's all said and done, what this is doing is actually distracting from the actual business of doing development. Everybody's caught up in side issues. Partners don't have fuel for vehicles, there's no fuel in Malawi, people can't get to A to B. So those things are having a real drag on not only this project, but projects as a whole. The third challenge has been the establishment of the Department of Social Welfare. Now, while that's a good thing, all of us who work in government in different ways understand that when you establish a new department, it means that people get shifted sideways, people get shifted up, and people get shifted down. And with that comes a whole range of complexities. So with the establishment of that department, it's meant there's been some quite robust debates within the ministry about what goes where. Where do you fit child protection? Where do you fit social welfare, workforce strengthening within the new structure in the ministry? So that's almost worked its way through now. So we think the first challenge and the third challenge is about to come to end, and the second one will be persistent for some time, we think. So overall, these challenges has led to a slowdown in preparing for the college for the first intake of students. As we said, we're looking at September 2012. But overall, the government is still very committed to the process, and the process is moving forward. Thank you.
Okay, thank you, Bruce.
Thank you.
Turn your microphone on when we're talking here. And then, what we'll do is go into the question period, and and I want to kind of pick up on a point you raised. I see somebody's clapping. That's good. We're all clapping in our heads here. The question you raised around, as you had your windy road, as you were going through it, around the various things that you're doing, which are great. You mentioned that you're looking to put together a human resource training plan, and you asked if others had experience with that. And so I would just say, as for others listening in, if you do have experience, you might contact or write Bruce and his colleagues directly, or even put in the chat room what that experience is like and exchange some ideas around it. From there, we'll go to that first question. I mean, you outlined a road around how many workers you have at the moment, what some of the needs are, curriculum being defined, school being put out there. So somebody raised the question and said, what is government's commitment and ownership in Malawi to hire the graduates? So could you comment on that, Bruce?
The commitment from the government of Malawi is very strong. Evidence to that is the 800 community child protection workers. So of those 800, the 300 have been transferred onto the government payroll and are being paid through government funds. And the government has given a commitment to moving the other 500 onto the government payroll next year. So commitments there. Whether, of course, the money will be there at the end of the day is another question. In terms of the graduates, the conversation at this point hasn't been about who's going to employ all the graduates, but the government has committed to allowing half of the students to be its existing people, which is a fairly strong commitment, I think.
Good. Thanks, Bruce. Another question says, we know that Malawi has a well-developed community health worker program. Are there plans to develop a similar cadre in the social service workforce?
Yeah, that's a very good question. Yes, and that's happened. That's what we call the 800 community child protection workers. In Malawi, I think it's 2,000 health extension workers. So it was sort of modeled on that, the idea to get the 800 up. They were initially funded through a stipend from a global fund, with the commitment being that Malawi would then take them onto the payroll. And as I said, it's taken on the first 300 and is committed to taking on the final 500 next year. So yeah, so that's that community level child protection workers who should be there to provide advice and support to more traditional forms of community practice around how to deal with certain child protection issues and broader social welfare issues.
Okay. Great. Just to kind of pull out one thing that you mentioned there is, so the Global Fund is providing some funding for the child protection officers that you're talking about. Officers may not be the right term for it, but I think that's good for everybody to listen to, because the Global Fund has kind of little windows of opportunity for some of this as they go forward around proposals, and that's a possible funding source. Another question here is, several countries have mentioned they are creating national committees or social welfare councils or associations, or strengthening them to regulate the practice of social work and set standards. Is this being discussed at all in Malawi?
Yes, it has. There is an informal group already functioning, and that's being supported through the Ministry for Gender, but UNICEF hasn't been very active in that network. But yes, one does exist.
I get another question here. It was more in the education realm. Is there a 4-year social work degree program, as well as the, I think is that a master's degree in social work? Yeah. MSW.
Give I missed your question.
Is there a 4-year degree program as well as the master's degree program?
No, currently what we have is a certificate program, which is for 1 year. But the curriculum has now been developed for the 3-year diploma and 4-year graduate program, and that is scheduled to start in September 2012.
Thanks, Bruce. Other questions you might want to write in, or do we have any questions here? Thanks, Bruce. What we're going to do next is open it up to discussion, and you know, this may range from comments or questions or further thoughts about any of the 3 presentations, or about your own country, team, sort of progress and challenges. So the question here on the slide is, it says, we want to hear about your workforce strengthening experiences. You know, what have you achieved, and what obstacles or challenges have you faced? Implementing your action plans or changing them from last year. And you can write that in the chat room. Or if you want, you could raise your hand and we could see if we could make the audio work.
We have another question.
We do have a question that just came. While people are thinking about anything they could do, there was a question that said, Bruce, back to Malawi, what plans do you have for community level workers that are already in service, but they may not have required either competencies or, I would sense, certificates?
There are two things in place. Through this college that is that's being upgraded to run diploma and degree courses, it has a partnership with the University of KwaZulu-Natal in South Africa. And so it's a curriculum that's been rolled out in many countries in this region where people who work in the field nominate to do the course. It doesn't cost them any money. They're matched up with a mentor, and their learning materials are basically competency-based manuals that that's sent to them. They read in their own time. I think there is 6 separate modules covering things like child protection, orphans, vulnerable children, community development, and so forth. And I think so far in Malawi about 130 people have graduated through that. And the challenge now is how do we expand that? How do we sort of take that to scale? So therefore the second activity scheduled for next year is to look at doing this human resource mapping of the broader sector out there to find out what are the needs and how can we develop something that focuses more on in-service training for people on the job.
Okay, thanks, Bruce. Now, sitting with us here in Washington, we also have a representative group from the Social Welfare Association in Tanzania, and we have one of their representatives who would like to make a comment now. So, if you could just introduce yourself, and then you could talk.
Well, I'm Leonard Biridi from Tanzania, the chairperson of Tanzania Social Workers Association. Well, I'm so happy, with the presentation, and I think it's very helpful to us. But I just wanted to know, what is the state of the workforce? When I'm saying the state of the workforce, I'm trying to, in terms of the numbers, that you need, as well in terms of the qualifications, for the, for what is needed in the field, the demands that are there. Somehow, somehow I failed to grasp during the presentation. So it's not easy, it was not easier for me to see what are the exact gaps that are existing. Okay. Yeah.
Okay. So if anybody can answer that from any of the 3 presentations. So what are the numbers? What are the exact gaps in terms of the workforce?
Yeah, the workforce, yeah.
Anybody want to try to answer that? Well, do you think you guys answering that one here? All right. So
Gary, would you like to go ahead and answer that question? Just engage your mic in the bottom left hand of the screen. You click on your mic and you'll be able to respond to us by speaking. You're also welcome to write your answer in the chat window.
So Sagai is perhaps writing something at this point, and we also have a question for either Uganda, Malawi, or Nigeria, or anybody else around what are the exact gaps that we're looking at. If you have that kind of data, I think Uganda has some of that.
Yeah. In Tanzania, we've been facing some challenges that are related very much to the harmonization of the curricula and making it relevant to the needs of the Tanzanians. I'm wondering, when I was hearing about both in Malawi as well as Uganda and Nigeria, how are they dealing with those challenges of making the education much more relevant to the needs of the people that yeah.
So you're asking the question for, and you heard a little bit from Malawi, Uganda,
yes.
how are they harmonizing education with needs?
Yes.
While they're thinking about that, what are you doing about that in Tanzania? What kinds of progress are you making on that?
Well, we are doing several things. First, we have tried to identify what we would call the core competences, for all the colleges, and the universities that teach social work related, courses, and have come to an agreement of those core competences. And second, we are conducting, each college is required to conduct a kind of a situational analysis. And we have developed a framework there where we are doing the whole, the exercise more jointly in order to assess what is the need, what are the needs of the people that we are intending to serve. And third, we are having what we call stakeholders meeting. After conducting a situational analysis, that all the stakeholders who are involved are brought together discussing, the findings, and those findings are incorporated in the curriculum of social, the social welfare workforce that we are training. Yeah, these are some of the attempts that we are making.
Okay.
Yeah.
So you're looking at defining core competencies.
Yeah.
And then having each of the colleges do a situation analysis, I assume, to look at how they either are or will be addressing those core competencies, or could address them, and then a stakeholders meeting to discuss the findings and to look at ways to spread these out.
Yes.
Okay. While we were doing that, we did have somebody wrote in a comment from Ethiopia, if I can find it. It's right up there. Well, no, that's good, Maureen. No, that's a big one. I'm going to read this. It says, Ethiopia update. The Ministry of Labor and Social Affairs has a model program running in one region of a one-year social welfare extension worker program that is accredited and excellent. We are engaging other ministries in a consultation that will expand the model under the proposed social protection policy, which includes strengthening the social welfare workforce as a mandate. The model is drawn from health extension workers from the Ethiopia Health Extension Worker Program, and they have 30,000 health extension workers in Ethiopia, and so we're very excited, it says in caps. Okay.
I wonder if Colin Marawanika is still logged in and could talk to us a little bit about what's happening in Zimbabwe right now. We also know that there's some really exciting work going on in Lesotho, and I see someone from Lesotho is also logged in. So I wonder if if representatives from either of these countries would want to report on what you've been able to accomplish. Perhaps I wonder, Colin, if you're having a little trouble engaging your mic, so maybe I'll do my best to try to summarize what's going on. I know we have Nankali here as well, and I want to take advantage of her being in the room and near a workable mic to see if maybe she could talk a little bit about what's happening regionally in some of the countries that she backstops and covers and supports. I'll start with Zimbabwe. We know at the conference last year we were able to hear about some of the initial findings of an institutional capacity assessment of the Department of Social Services. And that report is now public, and we're hoping that we might be able to make it available on obcsupport.net soon. It's a really excellent assessment, very, very thorough, and provides, I think, some very kind of concrete and achievable recommendations within that report. And it's exciting to see that many of those recommendations have already been, there's already been an effort to try to pursue some of those recommendations, including, as Nankali mentioned, this idea of shifting some of the tasks that a public social worker would be responsible for to non-public social workers, so that non-public social workers or private social workers or social workers potentially who are working for NGOs would be able to manage some of the cases that at this point are being managed by a very small but very capable public social service workforce. So that's something that's very exciting, and a new, it was new legislation or new policy that was passed that enabled that. Do you want to talk a little bit, Nankali, about some of the things that you've noticed that are happening in some of the countries that we haven't heard from today?
I think, Maureen, most of the countries that are making significant progress are those that have presented or those that have actually typed in. The thing that has struck me most during this webinar is just the commonality of the challenges and the solutions across the countries. I note that a number of countries came back from Cape Town and started to think about doing some kind of mapping or assessment of the social, whether it's social development, social service, or social welfare workforce. And Jim was trying to push the Nigeria team to talk more about the tools that they're using and who is supporting them on that. I don't know if any of the other countries can be able to share that. I know a number of countries, when we were asking about the progress that has been made so far, many have TORs in place. There's a struggle in finding who are the right consultants and completing the TORs. So if there's anybody out there who can be able to share some of that experience, please do so.
I wonder if I could also maybe talk a little bit about what's happening in Lesotho, because I had a conversation with our colleague Brenda Yamba last week about some of the really exciting work that's going on there. Since the conference last year, Management Sciences for Health, MSH, with funding from PEPFAR, provided some leadership and management training to some of the senior level officials within the social welfare ministry there in Lesotho. And as a result of that, what I've heard is that I think social workers at all levels within the workforce are now developing very concrete action plans. They have identified performance objectives. They have become much more effective in their job because they're very clear about what they need to do within a certain time frame. And that also the ministry has begun to organize some regional meetings to try to bring the different stakeholders together to assess how they are progressing towards their performance objectives. And that is something that's funded by the government, that the government had a budget line for this and is now using that funding to do more coordination and to really be very proactive about pursuing these objectives for kids and families that are vulnerable and need social service assistance. So that's very exciting. Oh, Lesotho, great. I hear it looks like Lesotho has been able to write in and provide probably more accurate information than I did. UNICEF has also been supporting the Department of Social Welfare with this organizational development of technical assistance with EU funding. So it's great. That sounds like it's an initiative that's very effective and supported by a range of donors as well as by the government. I think one of the things that was exciting for me to hear is that the government was that the Department of Social Welfare was also investing their own money and trying to do more coordination. So I don't know, Sutu, if you want to write in or engage your microphone and tell us a little more about that, but I was really excited to hear about it. So thank you for all you've been able to do.
As that's happening.
Okay, so we have another comment from Lesotho. Sorry, Jim. So with the same support from UNICEF, the Department of Social Welfare has been able to revise their job descriptions. That's great. Their performance appraisal system. But the Department of Social Welfare needs now to put these into practice. That's great. Well, that's a fantastic first step. I'm always intrigued to hear how people revise job descriptions and how governments and organizations determine what tasks are important and who should perform those tasks. And so, I mean, that's something that I hope we'll be able to talk about a little more in the future, because it seems like a very complicated process. And once you put those tasks into job descriptions, they could be there to stay for a while. So you want to be very intentional about really outlining who's supposed to do what. Okay, more from Lesotho. This is great. I'll just be your voice, Lesotho. So the Department of Social Welfare is now in the process of formulating a national social development policy. This is great. We're getting the story in installments, and it's, the anticipation is building. Our country delegation has two priorities. One was achieved, training for the Department of Social Welfare staff and child protection, but the second one is pending. And we have a smiley face. Okay, I'm busy on a report at the same time as I write to you. So, wow, this is pretty impressive. So you're multitasking. No wonder you've been able to accomplish so much. I don't know. And we're seeing some applause. Well, this is incredibly inspiring. I don't know if the report is about what you've been able to accomplish, but if that report is about what you've been able to do, I hope that you can share that with us so that we can circulate it more widely.
And let me go back just a second to the comment that Nankali made about the people that left the conference last year with the intent of doing some level of mapping and assessment. There are actually in several countries have done some level of that, and there are reports that are out on that and that are shareable, and they're probably located in different places, but it would probably be a good idea at some point to maybe locate them in one place so that countries that haven't done it yet can kind of access these reports. And actually, in some cases, the mapping and assessment is a bit of a misnomer because they go further than mapping and assessment. So it's mapping and assessment. The aim of the mapping and assessment actually is to create a sense of evidence-based decision-making and policies and action. And in some cases, that has happened too. So they've gone to the next step with relevant stakeholder leadership groups to take a look and say, based on the mapping and assessment evidence, what should we be focusing on? So I would encourage all of us to kind of begin to look at those reports and to say what's relevant for the country that I'm working in and what's the process they use, and can I use bits or pieces or all of that process. So that's going on. It's very active right now.
Maybe just a quick thank you to Farida, who was providing all of these updates from Lesotho, who may be voiceless, but is a very quick typist.
It's a good skill. Okay. Any other remarks before we ask Nankali to do a brilliant summary of everything that's been said? Oh, we do have one more.
So perhaps,
This is our colleague from Tanzania again.
Yes, well, perhaps I've not yet received the response about those deaths, perhaps from Malawi and other countries. But the other element that would like to know, what others are doing in terms of job analysis. One of the challenges that we are facing in Tanzania is the workload. The kind of workload that the social welfare workforce is involved in. So for those who've already done some kind of mapping or some surveys, I don't know whether that issue has been addressed.
I'm sure it is.
Yeah, that is a really good question. Actually, I ask this question of Amy Best, who's also here in the room all the time. What is an appropriate caseload?
Yes.
What is reasonable to expect a social worker, how many families should a social worker be able to work with in a quality way? I'm reading a book right now about probation officers in Los Angeles that work with the Juvenile Justice Court, and was surprised to learn that many of them work with 200 cases at a time. So, it is something that I'd like to know more about. How many caseloads are people working with, and how do you establish kind of appropriate ratios? And I don't know, Amy, if you want to say just a few final words on that, because I know that we have discussed those.
Right. Just to add, the NASW has done studies that are relevant to the U.S. that may or may not be relevant to other countries, but we can think of ways to get that out to the group, but to identify what are some realistic caseload levels for different sectors of the workforce. So whether you're working with children and families or with the courts or in different areas, what are some realistic caseloads? And so NASW has done some national surveys on that and studies for various groups, so we can make those materials available to everyone to see how it may be, see what pieces of it may be relevant in other countries.
It would also be interesting, and maybe this is obvious when we read what you'll be able to share with us, but how are those caseloads, how is that appropriateness determined? What are the criteria for determining, how many cases a person can does it have to do with level of complexity or distance, or it seems like we might have to consider lots of different things to come up with appropriate ratios in different parts of the country, rural areas and urban areas, or the world.
Let me add in here that somebody from Uganda wrote in and said, I think the question of the caseload should be put within the social and economic social context of each country. I think that's important. There's another, I think one of the perhaps, unexpected outcomes of some of these mapping and assessment efforts has been, what's the relationship of the formal workforce with the informal workforce? And I'm not even sure that's the right terminology. People are struggling. Is there such a thing as a non-paid workforce? Is workforce the right question? But a lot of work happens at the family level and the community level before it goes anywhere else. And so there's a lot of informal work that goes on. And that work is often not recognized by the formal workforce. And there is a gap between the formal workforce and the non-formal workforce, or whatever we're going to call it. And so I think there's much work to be done to say, how do we close that gap so that we're working in some kind of sort of harmonious effort to try to work together, as opposed to the only people that can do things are the formal workforce, when in fact we know that probably 40 or 50% of the work is done at a whole different level. So I think that's something that needs attention.
Well, funny you should mention that, because that was a topic that was suggested for our next webinar. So perhaps we can let Nankali bring us home, and then we can talk about the next webinar and how we can continue this conversation in the meantime. So thank you very much, Jim. And Nankali, bring us home.
All right. Thank you very much, Maury. I've been reflecting during the webinar. I think that before Cape Town, a number of organizations or a number of groups were having different efforts around system strengthening. What Cape Town for me was good at doing is bringing teams together to work together in a kind of coordinated fashion. Some made progress and some haven't, but we now have a recognizable team in many of our countries that are thinking, planning, and working on social welfare workforce development. Listening to the different discussions and feedback, I've called common challenges and common solutions running across the different countries. I wrote down a note about 10 steps in strengthening social welfare workforce, and I don't know whether it's something that we put down together, or it's not to say you go from one step to another, but clearly there are common steps that different countries are working on. I heard about the legal framework for the professionalization of the social work. I heard about work around the academia, adapting and updating curriculums. We heard about the associations, establishing and strengthening associations to regulate and update the sector. Government leadership, the kind of leadership from Mr. Kaboggoza or Mr. Kwassau from Nigeria, congratulations and keep that going. We heard about finding fiscal space for social service workforce strengthening, a common challenge for all, and Bruce talked about us working at a time when, the aid environment is becoming more challenging, and not just the aid environment, but even the revenues for our African governments are going down. So this is a difficult time to be coming into this type of work. We heard about advocacy with the public service commissions and also with policymakers on the need for social service workforce investment, and a number of ideas around how to get around that, and the issues paper from Uganda is clearly an excellent example on that. There's multiple players and clearly many coordination issues, and even multiple layers along the social workers as well, as we had from Nigeria. There's a lot that's going on. It seems to me that clearly we need a place to learn from each other. I think Mr. Kaboggoza highlighted that. The solutions seem to be similar, but how do we find the space to put together the reports from the mapping and assessment that Bruce talked about. Maybe this is a challenge for you, Maury, OVC.net, coming in again. Where can we find the common space to put these common things together? And you know, very simple things, the terms of reference, the consultants, the tools, etc. Let's find that place and let's all contribute into that. Thank you very much.
Great, thank you.
Thank you so much, Nankali. So I know that we are getting dangerously close to our cutoff time. So I just wanted to once again thank the presenters and facilitators and all of you who have logged in for your participation in this webinar today. I tell you, I always feel like it's, you know, that just at the very end, I'm still ready to go for another 2 hours. So I will look forward to the next one. I'm extremely encouraged by everything that we've heard about today. I feel like we have come a long way in a year, maybe longer than further than I realized. It's quite exciting, and we'll try to. We will try to consolidate some of these achievements as well and make sure that that's available on ovcsupport.net so we can all remain encouraged and inspired for the next 12 months. As a reminder, we're going to post a summary of this session, the recording, and the PowerPoints on ovcsupport.net, hopefully within the next week. We're also going to, I think we've answered most of our questions, but any other unanswered questions or ongoing topics for conversation we'll post in a discussion board, also on the website, so that we can continue talking about what we've done and what we're facing in our countries. The next webinar scheduled for January, the beginning of the new year, and it sounds like we have a great topic, the role of the non-paid workers within the social service workforce. So it seems like there's a lot of interest in this. I know we've been talking about this issue for a while. So if you or someone from your country team would like to make a presentation on this topic, please let us know. You can write to swws.webinars@capacityplus.org and let us know. And with that, I want to thank you again for for joining us today, and we will talk to you again in January.